Okay, we're going to do a microcrystal surgery brain detox, and we're going to do it in an in-person session. There's a big adaptation from how I was doing it in remote work and carrying it over into in-person work. We're going to start by putting a seraphonite cabochon on the third eye, and the reason is that seraphonite has a wonderful affinity for the nervous system and therefore also for the brain, since the brain is somewhat central to the nervous system. So we'll start by doing that. And then the general nervous system detox uses blue Uvite mica and seraphonite. I've got this nice seraphonite sphere, very lucky. And then I can just do this action, and this is what gets that detox happening. That's it. Ooh, we need it.
Yes, I think I do.
Practitioners should not go, All right. Okay, let me just get a bowl to clear this into. Here we go. Great. That's it. Come down here. Ooh. It's just been too stressful, hasn't it?
Mm-hmm.
Crazy. Nice. Right, let me switch hands. Let me use the Uvite in this hand and the seraphonite in there. And of course you can use any Uvite, but this blue Uvite mica is particularly pleasing to me for this technique. Good, so that is the general way to do a nervous system detox. And can you feel anything, Linda? Do you feel it soothing you or any effect?
Right here in my sinuses,
Okay.
heaviness.
A sensation of...
Definitely a sensation.
Right, I'm going to just... That's okay, I'll do it for you.
Yeah.
I'm just going to, because I'm going to do a layout of crystals here now for the microcrystal surgery transition. So I've got these little fine points. They're actually Colombian quartz. So I've got your head here in the middle, and then I'm going to lay out the microcrystal surgery layout next to your head, like this. Opposite that way. The terminations are pointing away from the head. And I found that in most instances that's the way to do it. Not always. It's something to check. Which way should the terminations point? So each one of these fine little crystals is a proxy crystal. And it's proxying for nerves and specifically synapses, the spaces between the crystals. So these spaces here symbolize the synapses and groom my intention for working on the chemistry of the synapses. And I have a few more stones here, so I am going to lengthen the layout a little bit. Now, if you don't have this many small crystals, you can use matchsticks or toothpicks to substitute. And so you can use a mixture of crystals, matchsticks, and toothpicks if that's what you need to do to get the number in position. And the crystals will convey the energy direct to the person. So we have an in-person session as well as a microcrystal surgery session, and now let's see what we do and how it feels for Linda. I'm interested to get your feedback on this. So again, start with the seraphonite, and I actually have to do each little proxy crystal. So where's my bowl? And so I'm not actually working with her head as the guideline, which would be more normal. I'm actually using my proxy crystal layout as my guideline. And here I go. Oh, it's strong. Can you feel anything?
Mm-hmm.
Is it strong?
Mm-hmm.
Wow.
Coming through here into my nose.
It's so interesting because here I am, not aiming for there via directly aiming there, but by working on the layout.
Yeah.
Yep.
It's in my eyes and below my eyes.
Yeah. That's it. Just start here. Wow, this really lays everything out so strongly. This is so much stronger than when I did it to you over your physical body. You have to be careful not to do too much. Don't want a crystal overdose. Ooh. Okay. Of course, it's really affecting you. Yeah. I'm just going to try doing it to your head. It's not as strong, look.
No.
It's
You're doing
gentler.
something.
Yeah, it's gentler. So this is stronger. See, this is the thing. You've got to do every bit of research and check all these things, so not to overdo it. One more pass through here. Okay, so there we are. That's that step. And next what I'm going to do is I'm going to take this Shungite pyramid and go into the synapses and just make sure the chemistry of the synapses is cleared via the Shungite pyramid. That's it. Now what does this feel like, Linda?
It's like a little tugging back and forth.
Interesting. Because I can feel the electromagnetism of the Shungite in the synapses, so it's interesting you can feel it too. Nice. Wow. Okay, so now I do like to go over the corpus callosum, and that is actually here in the middle of your brain, so I'm going to actually do it on there, and that does need it, so I'm just going to do that a few times. Midsection of the brain, that's it. And the midsection of the brain is all very confusing, like what does it do and so on, but I tell you what, you can tell in the energetics how very important that midsection of the brain is. There we go. Wow, that's so strong. I'm back on the synapses on this side, on the right side. Very good. Very good. Wow. Okay. So now that I've cleared with the Shungite, now I want to do Shungite pulsing. And normally we'd go about 18 inches away from the head, from the physical body, so 18 inches away from your target point. And I would pulse like so, and squeeze the Shungite as I'm going. Okay. But because I'm doing microcrystal surgery, I need to pulse these proxy crystals. And boy, it's stronger, isn't it?
Mm-hmm.
I have to do it more times because I have to reach all these crystals. And of course this is not 18 inches away or anything like that, but it is far, medium, and close still. Go back this side.
Feels like a clearing.
It's exactly what the pulsing with the shungite does, and I do wonder if this would help people delay Alzheimer's and other kind of cognitive decline, whether this could be helpful for that, because I think it might be. You know, they were talking about the senescent cells have to be cleared, and I think that's what shungite does. It helps clear senescent cells, and senescent cells are cells that are old and have become debris and in the way. And when we get old, our bodies don't want to clear those old cells as efficiently, and that's part of our difficulty. And shungite will help us with that cellular metabolism. That's the point. And it's just a fabulous stone in that regard. I'm totally enamored of shungite as I speak. It also only comes mostly from one place in the world.
Where?
Siberia, Shunga province in Russia. That's it. Yeah. How's that feel?
I think I'm gonna fall asleep.
Yeah, you are sounding drowsy. So it's very relaxing.
Mm-hmm.
Is it calming also?
Yes.
Any other notes to it before you drift off? Okay. So that's that. And then after we've done that with the shungite, we've now cleared everything we want to clear. So now we do a little bit of healing work. And I like to use the morganite. And this is what's so fantastic, because you can't get that morganite into the brain. And so you're able to get the morganite into the nerves and the synapses by having this proxy layout. And we'll see how this feels. Of course, it may put you to sleep. And I literally go over every single proxy with the morganite. It's slowing your heart, isn't it? You can't even talk now. Okay. Gotcha. Now, to my delight, I have this fancy piece of morganite which I love, but I also have these tumbled morganite stones, and they work just as well. She goes. She's asleep. It's already been done. I can go here. Perfect. Okay, and then the last step is to put a little tangerine quartz energy into the tips of each proxy crystal, because that is a protective measure so that the nerves are not so overly sensitive. You see, it made her shudder. There we go. Nerves can get very irritable, and that's the meaning of the word irritable. So when the nerves are overly sensitive, and this protects, it soothes. feel like I've got a watering can and it's like watering plants. But I just ask yes or no, and I must do this side first. Just keep the brain balanced in this regard. So this action is called treating, where you just tip the crystal and pour a little bit of the chemistry into the tips. And I do this very patiently, because you do want to do every single proxy crystal. And if you had toothpicks and matches and an assortment of little slender points, you would do every toothpick and every match. That's why you don't want to do too many proxies, because of the amount of time it takes. You want just enough that grooms your mind, grooms your intention, and gets you depositing the chemistry into the energy field from where it will go into the physical body correctly. That's it. That's it. I think I'll just grid the physical body with the tangerine quartz also, just to finish. It feels like a lovely idea. And there we are. The first adaptation from microcrystal surgery back to in-person work. How brilliant. Thank you.